pain comes in when your body's trying to tell you something's wrong, right? But a lot of times, it's not usually the first sign. It's usually one of the last signs. Hey everybody, this is Dr. Tam and Rocky here, and today we have another amazing episode on what is osteoarthritis and all the symptoms, causes, and problems that comes with it. So Rocky, let's get started.
All right. Hello, everyone. So, osteoarthritis is the most common form of arthritis affecting 32.5 million US
Wow.
adults.
Yeah.
And this condition can be one of the top reasons why we become inactive as we age. And that inactivity can ultimately lead to an increased risk to other diseases, right?
Right.
So, Dr. Tam, can you tell us more about what osteoarthritis is?
Absolutely. So osteo is bone. Arth means joint. Itis means inflammation. That means there is inflammation between the joint, between the bones. That's what osteoarthritis means. Well, how does it happen? Right? That's the big question.
Right.
Is people always ask, how did I get this way? How did I get osteoarthritis? Well, what happens is as we age, there is something called normal wear and tear. Okay? But as it goes, normal wear and tear, the bone should still keep its form, right? And still stay in good shape. Our bodies are made to last, science has proved it, about 120 years. Okay?
Wow.
Yeah, it's made to last that long. Now, here's what happens though. There are internal and external factors that can cause inflammation of the joints, right? Between the two bones and that space between the bones, that's a joint. For example, our fingers, we've got joints between every bendable part of our fingers. Here, here, here. We've got multiple bones in the wrists. We have the joint between the wrist bone and the forearm, right? Then we got the elbow, the shoulder, all these bones. Now, external factors. External factors are injuries, falls, accidents that can cause a shift in that joint or overuse of that joint, grinding on each other, right? So sometimes injuries and overuse of a joint can cause that joint to inflame. Well, if that joint inflames, inflammation is a natural process, all right? We should have
Right.
inflammation because inflammation is how the body heals. The problem is when we get chronic inflammation. That's when the body inflames, but it doesn't have enough time or the ability to deflame, right? So you're always inflamed.
Right.
And eventually it's like a fire, you know? The stove, like when you're cooking, is the stove supposed to get hot?
Mhm.
Yeah,
Yeah.
right? Normal. You wouldn't
Mhm.
be cooking if the stove didn't get hot. But what happens if you left the stove and the pot on there way too long?
Gets
It
burned.
gets burned. The pot itself will
Mhm.
burn, right?
Mhm.
It's kind of like
Mhm.
osteoarthritis.
I see. All right. And is this condition something that, everyone is expected to get as we age?
Well, if you have injuries, if you played hard, if you haven't corrected the problem, then over time you'll get it. You will get it,
Mhm.
right? Is it normal? No.
Right.
But is it common? Yes. And now that we know what it is, you need to get it corrected. You know, hey, does every chef burn a pot here and there? Yeah.
Yeah.
right? But you can't burn it all the time. You see, even the
Right,
best
right.
pots you can burn and it'll leave a burn mark and you scrape that off. But if you burn that too many times, it leaves a hole, doesn't it? Now it becomes a
Yeah.
permanent problem. You can't fix that problem. So, and joints can wear down to the point where it
Hmm.
has nothing, you see.
Right.
And my job is to try to catch those joints before it becomes nothing, becomes irreversible, you see.
Hmm. Right, right. And it's said that osteoarthritis can be a result of, just like what you said, how we use and abuse our joints,
Mm-hmm.
right? So a lot of athletes,
Yeah.
dancers, really get it as they
Yeah.
age. So can people who live a sedentary lifestyle get it as well?
Absolutely.
Like just in the office.
In the office, because it becomes of a permanent, more like a repetitive, right? Posture. So if your head is just sitting, your head's always forward, right? If I'm sitting and my head's always like this, looking at the screen, eventually the weight of my head is going to weigh down my neck. And now you end up with, instead of a trauma induced osteoarthritis, repetitive use osteoarthritis, because it now becomes a chronic positional problem, you know, that becomes a problem as well, right? If you're sitting all the time, all the
Mm-hmm.
pressure's on your lower back, and you don't get up and stretch once in a while, well, eventually that disc in the lower back's going to start flattening over time because you never did what was right to stretch it back out. You see? Yeah. That's why sometimes when people see me
Right.
shifting in my chair, that's because the back support on my chair starts sliding a little bit sometimes and I have to readjust. You see, it's being
Yeah.
aware of what's happening. Mm-hmm.
Mhm. Right. And that's very common nowadays, especially that, everyone still work at home, right? So it can be very, it can be one of the things that we can ignore,
Now,
right? Our posture,
here's the other
the
thing.
length of time.
Yes, here's the other thing. If you're not eating correctly and you're eating foods that causes an internal inflammatory
Mhm.
response, you could be laying down and your joints will inflame. See, that's like starting a
Uh-huh.
fire from the inside, and your
Right.
body will burn and inflame that joint from the inside out. And now you're going to wear out that joint.
Mm. And speaking of inside out, Dr. Tam, can it be, is it hereditary?
Well, osteoarthritis is usually
Mhm.
not hereditary. There are other
Mhm.
forms of arthritis that could be
Mhm.
hereditary, but not osteoarthritis. You see?
I see.
Mm-hmm.
Mhm.
Yeah.
All right, yeah, because I heard that there are 100 types of
Yeah.
arthritis.
See, because arthritis just means that the joint is inflamed. Well,
Hmm.
why
Right,
is the joint inflamed? You
in the
see?
first place.
Yeah. So that's
Hmm.
osteoarthritis is just one of them. The bone is inflaming, right?
Hmm.
So,
Right. And is weather a factor of, getting pain when it comes to osteoarthritis?
well,
Because I always hear my dad saying that.
yeah, yeah. So pain comes in when your body's trying to tell you something's wrong, right? But a lot of times it's not usually the first sign. It's usually one of the last signs. Think of this.
Mhm.
We have teeth, and teeth is just bones that we can see, right? By the
Right.
time your tooth hurts, you go to the dentist, they tell you have a cavity, right? Oh, you have a cavity in the back of your tooth. And then you ask the dentist, did it just show up yesterday? What do you think the dentist is going to say?
Of course
Of
not.
course not. It's been there a long time. So pain sets in when it's gotten bad enough. So by the time the joint starts hurting, you've been dealing with it for a while. It's not the first time. And you take that x
Mhm.
ray, and now we see the bone decay eating away. Okay. And now you have osteoarthritis, and we have to really treat it now. By the time you feel it
Right.
and you don't even treat it, oh my gosh, you got hell to pay later on. Then
Hmm.
it becomes a
Yeah.
permanent damage, right?
Hmm.
Mm-hmm.
Right. And how do you diagnose osteoarthritis?
Well, during the exam, that joint is going to feel painful, tender, warmer, right? And then when you take an X-ray, you're going to see the outer layer of the bone starting to eat away like a cavity.
Mm,
See,
wow.
just like a cavity.
So it's like the cavity of the
It's a
bones.
cavity of the bone. Yes. Uh huh.
All right. Okay. Well, we're gonna do a couple more videos about osteoarthritis because obviously it's a very large topic to cover, right? So, if you haven't already, please go ahead and subscribe to our channel so that we can go ahead. You can learn more about osteoarthritis. But thank you very much, Dr. Tam, for those for your for clearing out or for your knowledge about osteoarthritis.
Right.
We'll see you on the next
Thank
videos.
you so much, Rocky. We'll see you guys soon.
All right. Bye
Bye
bye.
bye.